For the last few months, we've been able to receive the COVID-19 vaccine. Local 12 Investigates found that there were highly qualified healthcare professionals who sat on the sidelines for the vaccine while students and techs did the work. Gary Miller explains in our series Athletes at Risk.
I was really excited when I first found out we could get the vaccine.
When the COVID-19 vaccinations came to Finneytown, Superintendent Terry No decided she wanted to offer the vaccinations in her school district.
And I thought that would be really easy with our district nurse, who is an RN and fully qualified to give an injection, but then started hitting the roadblocks.
A nurse would need a doctor's order. Most school nurses don't work under a doctor's oversight. No did have a qualified healthcare professional in her district who does work under doctor's oversight, her athletic trainer. An athletic trainer's job is to provide health care on a field that can be life-saving. Trainers receive hundreds of hours of education on skills like injections, and most have a master's degree. But there was another roadblock.
By law, they're not allowed to give the injections.
Siobhan Fagan is the immediate past president of the Ohio Athletic Trainers Association. She testified Wednesday to the Senate's Health Committee on House Bill 176.
Unfortunately, our name, a lot of times, athletic trainer, a lot of times people don't understand what we do and that we are a healthcare profession. And so we've had to do a lot of education over the years on who we are.
Under the current law, if athletic trainers gave an injection to someone having an allergic reaction or an asthma attack or other life-threatening emergency, the athletic trainer could lose their license. So when it came to the biggest prevention in the fight against COVID-19, athletic trainers sat sidelined. Local 12 Investigates found that those that were allowed to administer vaccines across Ohio had far less education, training, and qualifications. Take this email we received from a local health department. It shows that nursing students helped administer local vaccines. Nursing students have less training and education than a licensed athletic trainer. Then there's this update from the state of Ohio saying the U.S. Department of Health and Human Services authorized pharmacy technicians to give the COVID-19 vaccine. Pharmacy techs can complete a one-year certification program or get an associate degree, which is less than the qualifications of an athletic trainer. At Finneytown, their first round of vaccines came from Springfield Township EMS.
And it was a wonderful turnout.
EMS in Ohio are issued certificates to practice and have less training than athletic trainers.
The athletic trainers oftentimes had far more training than the people who actually gave the injections. And our partner was wonderful to step in, but we had people right here that could have
take your temps again.
been a resource for us.
We asked more than 100 athletic trainers across Ohio how they felt. The same word kept coming up: frustrating.
When people don't want to use athletic trainers or don't think about using athletic trainers because we're an untapped resource of great potential.
We asked the Ohio Department of Health last month why athletic trainers weren't allowed to administer the vaccine. Their answer? They're not authorized to do so. We emailed ODH last week to understand how others with lesser qualifications were selected. We are awaiting their response. House Bill 176, if passed, will update the law that governs athletic trainer licenses.
Essentially, vaccines would fall under that, and so the athletic trainers would be able to administer vaccines if given permission by their physician.
The bill would update the care athletic trainers can provide to match current skills they're learning in the classroom. Those skills include injections, which they learn in Athletic Training 101. Gary Miller, Local 12 News.
Now, if the bill does pass, athletic trainers could likely administer COVID-19 boosters this fall. You can find out more about the bill at athletesatrisk.com.